Good evening, ladies and gentlemen. I, Colonel Dinesh Verma, on behalf of Organizing Committee, welcome you all to this inaugural session of the IMA National Telemedicine Day. The virtual audience who have joined us for celebrating this important day. Indian Medical Association, Telemedicine Society of India, and ISRO endeavor to utilize the telemedicine as a tool to bridge the ever-increasing urban-rural health divide. We begin the inaugural session of this IMA National Telemedicine Day with the aim of creating massive awareness which will go a long way in utilization of telemedicine services. It is my pleasant duty to introduce to you the dignitaries who would be on the stage. Dr. K. Ganpati has been the past President, Telemedicine Society of India and Neurological Society of India. Mrs. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals. Mr. Ashok Sangal, President, Telemedicine Society of India. We have with us Dr. P.S. Bakshi, Vice President, Indian Medical Association, and we have Dr. Rajendra Iron from Indian Medical Association. The guest of honor, Dr. K. Sivan, Chairman, Indian Space Research Organization. May I now request the dignitaries to take the seat on the stage for the inaugural session.
Please come. Sir, who wants? Please come up.
May I now request Dr. K. Ganpati to please deliver the welcome address. Dr. K. Ganpati has been past President, Telemedicine Society of India and Neurological Society of India. He is President, Apollo Telemedicine Networking Foundation and Director, Apollo Telehealth Services. He has the distinction of being the first neurosurgeon from South Asia to be formally trained in stereotactic radiosurgery in 1995 and later in robotic radiosurgery in 2008. Over to Dr. K. Ganpati.
Good evening, everybody. Honorable Dr. Shivan, Chairman, Indian Space Research Organization, Sangeeta Reddy, Joint Managing Director, Apollo Hospital Group, Ashok Sangal, President, Telemedicine Society of India, representatives of the Indian Medical Association, officers of the Armed Forces Medical Service, ladies and gentlemen, not forgetting the hundreds of people who probably are logging on and are participating as virtual participants. It is indeed a privilege to welcome all of you to what I believe is truly a historical day. I may become a little emotional today because it was on this very day, 18 years ago, that I vividly remember a cardiologist at Apollo Hospitals, Hyderabad, examining virtually a young child with a hole in the heart in the village of Aragonda, a village about 20 kilometers from Chittoor in Andhra Pradesh. Today when we talk about 5G, this becomes absolutely irrelevant. But believe me, in 2000, when the rest of the world was still not aware of what very small aperture terminal meant, particularly in the field of healthcare, this was indeed a historical moment. To us, it was not symbolic of what was done then. It was an indication of what would come. In a way, I am frustrated. 18 years have passed and I do not think the growth was exponential the way we believed it would be then. But the first 10 years was indeed a struggle. People laughed at us, people ridiculed us. But over the next 5 years, things fell into place, and in the last 3 years, the growth is slowly becoming what Dr. Pratap Reddy, Chairman of Apollo Hospital Group, always believes in. He does not like incremental growth. He believes in 3x, 5x and 10x. I so vividly remember he's telling me a couple of years ago, he said, I want 1,000 telemedicine centers in 1,000 days, and each day you should do 1,000 teleconsultations. I said, most respectfully, I said, sir, you are talking about what is absolutely impossible. Today, I eat my own words. I realized that 1,000 teleconsults a day, 1,000 telemedicine centers for one individual organization is truly believable. And I went back and apologized to him. I said, sir, what you said is going to happen in my lifetime, and I assure you that this is going to happen. So this is the real world. Information and communication technology has shown an exponential leap. 167% is the tele-density of urban India. Every 100 people living in cities have 167 SIM cards. More than that, rural India, where 750 million Indians live, has an astonishing tele-density of 57%. We are on our way to becoming the world's leader in the utilization of internet through wireless methodology. We no longer piggyback. We of course don't follow. We no longer piggyback. We don't even leapfrog. How far can a frog leap? We pole one. And I am sure that in the next few years, the West will be looking to us in the deployment of 5G. There was a communication from no less a person than the Telecom Secretary, Government of India, stating that 5G is on the forefront of the Government of India's ambitious plans to involve connectivity. And she made a statement that India will be the leaders in the deployment of 5G, though we fell back in the use of 3G and 4G. This, ladies and gentlemen, is a true world, the world we live in today. The growth of development and telemedicine, as I said, was extremely slow. The National Telemedicine Day, today we do not have the authority, we do not have the right to call it National Telemedicine Day. The IMA National Telemedicine Day, as we call it, is a formal recognition that telehealth has come of age. We are 18 years old to this day. We have a right to vote. We have become adults. We have a right to be heard. And I hope this National Telemedicine Day will be the beginning of what, like the World Diabetes Day, World Cancer Day, World AIDS Day, etc., etc., the WHO, World Health Organization, lists 450 World Health Days alone. And believe me, a formal declaration of a national day, a world telemedicine, whatever it is, a World Health Day, has done wonders in creating awareness, has made a radical change. I strongly believe that what we require is not the deployment of technology, but creating awareness. Today we talk of promoting wellness the e-way. What is required is not early diagnosis and treatment, fantastic robotic surgery, but what is required is preventing many of these illnesses which could take place. Mr. Sangeeta Reddy has already mentioned pilotitis. I think this has become an epidemic. I always used to state that there are more pilots in telehealth in India than there are in the Indian Air Force. Proof of concept validation is another euphemism. I think the stage has long gone. It's a pity if today we need to convince the bureaucracy to do pilots and proof of concept validation. What we need today is escalation of what we have certainly proved over the last 18 years. We need to do, I agree, we do not have statistically significant, scientifically valid, double-blind, randomized control studies, if you call it, to prove that telehealth intervention has significantly made a difference. But every one of us today, the biggest skeptic, people who laughed at us, agree that today distance has become meaningless. My favorite phrase is, geography has become history. The digital transformation of India in the last few years is unbelievable. Would I have ever thought that with my mobile phone, I can order vegetarian food and book a second-class sleeper upper berth automatically because I'm a senior citizen? The software automatically gives me a lower berth and not an upper berth. It automatically gives me a 40% discount and so on and so forth. Unfortunately, all over the world, particularly in India, the healthcare industry is extremely conservative. No surgeon wants to be the first to do a surgery. No physician wants to be the first to try out a medicine. Those days are over. Today, I think we have convinced a skeptic, as Sangeeta mentioned in the last session, telemedicine should not be a specialty. I often say we don't have a stethoscope society of India, and I would be the happiest person if there is, and I think there should be, a telehealth department in every tertiary care hospital. Unfortunately, the word telehealth is not as sexy as it is to have a gamma knife or to have robotic surgery. The CEO of any hospital would sanction funds for robotic surgery, not necessarily for a telehealth department. I think this should change. We can certainly make a major impact, particularly in the field of public health. Unfortunately, we sincerely hope that accepting the necessity for a National Telemedicine Day is the first step. Reimbursement of teleconsults by insurance companies has led to a phenomenal change in the deployment of telemedicine in the United States. The National Health Protection Scheme, which has just been tabled in Parliament, offers a unique opportunity to provide quality, affordable, accessible healthcare to anyone, anytime, anywhere using telemedicine. It is time for the government to form a consortium of telehealth players across India. When I was a member of the National Task Force of Telemedicine, along with several of my colleagues who are sitting here, 15 years ago, we had suggested that like to have various public sector undertakings, we should have a Telemedicine Corporation of India with equity participation from all those interested. India is a continent, it's a huge country. There is enough to share the spoils, if you want to call it. The various private players can get together. There are various means in which we can decide who is going to do which zone and thing. But I think the time has now come to form a Telemedicine Corporation of India which will have accountability and responsibility. Perhaps we were too far ahead of the time when we made these suggestions. As Walter Hugo said, nothing can stop an idea whose time has come now. Obtaining recommendations after brainstorming in implementing them would go a long way for fulfilling it. I think it's time for the National Task Force to be revived once again with clear aims and objectives and a time frame given to it. May I once again welcome not only those who are physically here, but the hundreds of you who have taken the trouble of logging in to the URL. Though I cannot physically see you, thank you once again for joining in this program. We are particularly thankful to the Chairman of ISRO, the Indian Space Research Organization, and the Armed Forces Medical Services. To me, right from when I'm a teenager to though I'm a senior citizen now, have been two great departments, and how I wish that these civilians would imbibe the philosophy, the work ethics, the passion, the enforcement which both these departments together represent. Thank you, ladies, once again, and I do hope that over the next 90 minutes we will take some decisions, and I hope there is some media coverage, and I do hope that the public become aware that telemedicine has reached the stage where it should be incorporated, integrated into the core of the healthcare delivery system. Thank you once again.
Thank you, sir. May I now request the guest of honor, Dr. K. Sivan, Chairman ISRO, and other dignitaries on the stage to kindly light the sacred lamp of knowledge which dispels the darkness of ignorance. Thank you, sir. May I now request Mrs. Sangeeta Reddy, Joint Managing Director, Apollo Hospital, to present a memento to Dr. K. Sivan, Chairman, ISRO.
You are now unmuted. You are unmuted. You are now unmuted. You are now muted. You are now unmuted. You are now muted. now unmuted. You are now muted. You are now unmuted. You are now muted. You are now unmuted.
Shri Shri Ashok Sangal, President Telemedicine Society of India. May I request Dr. Sivan, Chairman ISRO, to present memento to Dr. Ashok Sangal, President Telemedicine Society of India. Dr. K. Ganpati, past President Telemedicine Society of India and the convener.
Can I request to Shashok Bajpai please to join me? Shashok Bajpai is the Managing Director of Apollo Hospitals, Delhi, Indraprastha Hospital. Please come, sir. You are giving it to me. I don't know. Who is giving? Who is receiving?
You are receiving, sir. Oh, this IMA. I am a life member of IMA, sir. We request Dr. Sivan, Chairman ISRO, to present mementos to all the dignitaries on the stage. Thank you, sir. May I now request the dignitaries to take their seat on the dais. Forward his address. Mr. Ashok Sangal, President Telemedicine Society of India, is an expert in satellite and terrestrial system for broadcasting, telecommunication and IT network. He was involved in assisting establishment of integrated development communication network and uplink in all the states of the country, which also extensively supported e-governance and healthcare during post-tsunami operations. Shri Ashok Sangal.
Good afternoon, sir. Chairman ISRO, Dr. Sangeeta Reddy, Dr. Ganpati, Dr. Bakshi, Dr. Rajesh, and my friends. This Telemedicine Society of India was established with sole aim of bringing technocrats and medical professionals. You would wonder, this is the only society in the country which has technocrats and medicinal people. It's a common platform to popularize and support remote healthcare in a scenario of wide gap in the doctor-to-patient ratio. It was established in the year 2001 and had held number of national and international conferences before the TSI got registered in 2006. It is currently headquartered at SGPGI, Lucknow. Since then, the 13 international conferences on varied themes, numerous programs on medical education have been conducted, and several doctors have been trained through regular conduct of CMA by those who are not its members. Next, please. Next slide. So one of the conferences was very wonderfully held at Bangalore, sir, at the headquarters. It's wonderful. That was in 2006. The uniqueness of the society is that it is the only platform where technocrats and doctors, as I told you, are both the members and interact on the common platform to support remote healthcare, to provide technological and medical solutions. Every year conferences are held in rotation to cover all regions of the country. This is the uniqueness of this society, that is, we hold international conferences in every nook and corner of the country in rotation. No part of the country is blank. The membership was just 214. It was started with just 14 members in 2006, and today it is 500, more than 500. Maybe 30% are engineers, and around 30 are the defense personnel. Next. Apart from the headquarters activities which are holding the international conferences, in order to support the regional outreach, Telemedicine Society of India has set up in 8 chapters in the states. The Rajasthan, Uttar Pradesh is coming up now, next month, Odisha, Karnataka, Andhra Pradesh chapter was just inaugurated yesterday. It was wonderful setup. Telemedicine, Tamil Nadu, Madhya Pradesh, and Maharashtra. So you see here, we have set up the chapters in all regions, north, south, east, west, all the regions of the country, which we are now vigorously trying to have a chapter in northeast, Guwahati, and our people are trying their best. So it is not setting up the chapters. Wherever chapters we have set up, about 80% of those regions are extremely developed. I just take the case of Odisha. Odisha was seen as a backward region. They hold conferences every 6 months in the primary and tertiary regions, and they go to the villages. Next conference they have in Kyonjhar, which I am going next month, and they have been able to set up a beautiful telemedicine network, which involves, apart from the government-funded limited notes, to the public-private partnership way of taking up the healthcare. These are ably carrying out activities not only in the tertiary region but also primary region. The Telemedicine Society closed user groups enable interaction among doctors, users, and implementers very effectively for mutual solutions. So recently we have set up a telemedicine interest group, and I was elated to see the response on the network. The users put up their problem, the corporates or the startup come up with the solutions, and then they get network, and then the region which is not reached or covered, they are able to set up the network. Be it tele-ICU, be it any type of network, the solutions are there on the closed group. Next please. We also have the international research. Telemedicine Society of India also involves during conferences eminent experts from abroad during Telemedicon. We call the international conference yearly the Telemedicon. This year it is Telemedicon 80, which is being held in Amaravati, Andhra Pradesh, whose organizing chairman is in the audience. Some of them are overseas members and some are honorary life members. So this year we have been able to have 2 life members, honorary life members, one from Japan and another from the United States. TSI also is a member of ISFTEH, an International Society of Telemedicine and E-Health, with whom TSI exchanges knowledge for mutual benefit along with the American Telemedicine Association, ATA, Medical, next. Other supporting activities are the which TSI is involved, Telemedicine Society, laying down medical standards not only for desktop applications but also for the mHealth apps interface. We have made several committees where representing each and every segment of the people in evolving the standard for mobile apps. TSI is branded as the supporting association for medical tourism and wellness council 218, bringing together health administrators, technocrats, startup and partners. We have corporate members, we have 5 corporate members, more than 5 startup members. They amply contribute to the society. Expectations, sir. Today I see a sense of satisfaction on me and all my colleagues when they find that it's not, I say, only TSI, it's everybody's effort, but TSI has been able to network corporates, network administrators, institution members, and so on and so forth, so that the network growth is established in the country and it is going leaps and bounds. Everybody is looking towards the Telemedicine Society of India with a hope. I get several letters, several mails. Well, how can the TSI help us in setting up a network in my state? They are insisting that TSI should be one of the important, play an important role at national level to interact with health and also the space utilization. Users desire that methodology for state networking be evolved at etc. effectively support health. Next. Hope with your support, sir, TSI will be able to live up to the expectations. Thank you very much, sir.
Thank you, sir. Due to some commitment, National President IMA couldn't join us. I would now like to invite Dr. Rajendra Iron, Vice President, Indian Medical Association, to deliver his address.
ISRO Chairman Dr. Sivan, Joint Managing Director of the Apollo Group of Hospital, Ms. Sangeeta Reddy, Dr. Ganpati, the President of TSI, Shri Ashok Sangal, and my colleague, my brother in IMA, Dr. Bakshi. At the outset, from the IMA headquarters, I apologize for the absence of our President, Dr. Ravi Wankhedekar. And I speak from my heart, not from my brain. When Dr. Ravi Wankhedekar asked me to replace him due to our Mahapanchayat due on 25th of March, I was not very much interested in what I will do here. It is not my subject. By profession, I am a urologist. By activist, I am a Senior Vice President, IMA headquarters. I am a member of Medical Council of India. What I will do here? But as soon as I enter in the hall and listen, whatsoever little bit I can hear, it is the great privilege I have and it is the great knowledge which I acquire here. Our India reside in villages. We have 6,50,000, more than 6,50,000 of villages. 72% of our population reside in the villages. Dear friends, I would like to ask you, how many of you are living in a tehsil place, that is a population below 1 lakh? Is anybody in the hall? No. And this is the mockery of our system. What we see from Delhi, in Delhi, a person have a height of 6 feet, and when he reach at a small place, he become a man of 6 inch only. And here we lack, and here we lack in our services. Our beloved Prime Minister Modi ji is talking about digital India, and this digital India will not complete till we will serve what is in the words of Pandit Deen Dayal Upadhyay, अंतिम पंक्ति के अंतिम व्यक्ति तक, the last man of the country, till he receive the services of our these services of our science. It is the dream is not fulfilled. And here, by telemedicine, what I can see, yes, it is possible. It is possible. Here, before beginning my few words, I would like to talk about two things. I am member of Ethics Committee of Medical Council of India. There we see a lot of ethical issues. And here in telemedicine, definitely newer ethical issues will arise. So I asked Dr. Sangal and Dr. Ganpati to chart out some code of ethics. We are professionals, we are not businessmen. And when we label ourselves as professional, a professional has to fulfill the 7 criteria to label himself as a professional. That is a school of training, a university to grant him his degree, a registering authority, a code of ethics, a full-time vocation, a local association, and a national association. The code of ethics is very important. This differentiates us from businessmen. So I request Dr. Ganpati and Dr. Sangal that now it is almost 16 to 17 years or 18 years of establishing our this TSI. So they work for this code of ethics, and at present at Medical Council of India and at IMA headquarters, we are rewriting the code of ethics. And this task is given to me. So if you can suggest some code of ethics for this telemedicine also, it will be a great service to the nation. Second thing, what is, when I was attending a conference of Urological Society of India in year 2000, they have discussed about transatlantic radical prostatectomy, and Dr. Mani from US came here and he demonstrated that transatlantic radical prostatectomy. But this may be the need of less than 0.1% of our population. Most of our population, what they want? In the remote area, at the 11 p.m. or at 12 midnight, when a patient comes in asthma, the local health provider or local doctor is not aware that it is a cardiac asthma or it is a bronchial asthma. The treatment differs a lot. And say, if by our telemedicine we can give him the diagnosis, I think many a life can be saved. In a remote area, say a dehydrated child, when we see a dehydrated child, the local nurse or the local health provider doesn't know the severity of that dehydration. If by our telemedicine, you know, our mortality from this diarrhea, dysentery and malaria is much more. If our telemedicine can serve this purpose, I think it will be a great service to the nation. One more thing, our India is poor country. Here the problem is maldistribution of the assets, maldistribution of the money. So we have to make this telemedicine cost effective. It should be cost effective to serve our last person in the remote area. That should be our aim and idea. What is the thing we can do? We at IMA have at least more than 10 lakh 30,000 doctors registered in the Indian Medical Register. There may be some duplication. There may be some have migrated. There may be some have left for the heaven. But still, it is our prediction and it is our assumption that at least 8 to 8.5 lakh doctors are serving in the country. So it is not again the deficiency of the doctors, which government, bureaucrat, media and each and everybody talk. But again, it is a maldistribution. In metros and in big cities, we are concentrated. Our doctors, our medical facilities and all these things. So how to overcome this thing? And the answer is telemedicine. And definitely, when we were suggesting to our health minister, to our PMO, to our prime minister, that what they want to bring the National Medical Commission bill to gap this difference between the available doctors and the population. On one hand, they want to provide best of the services, the quality services to each and everyone. And on another side, they want to allow the cross-patching. It is not permissible. And I think in tomorrow's Mahapanchayat, I will also discuss that the answer to give each and every citizen of the country the quality services is resting in the telemedicine. And I think we should work on this. And Dr. Sivan, just I was talking with your director, Mr. Virendra Kumar, what he was telling, that they want to work in the field of medicine. But nobody was supporting them. I assure you, from this IMA, from the strength of 8 lakh doctors, from the strength of 18,000 branches in each and every state of India and Union Territory, that we will support you. We will join hand with you and we will make it possible. I myself and my colleague Dr. Bakshi are very much interested. We were coming here, when we were coming here in the car, we were talking about this thing only. How can we serve to our nation? And sir, I invite you to send your delegation to our IMA headquarters, and I suggest that if our country is a very big country, we can't serve from one area. If initially we can make we can have a discussion, and if possible, we can have a head office at our IMA headquarters, and second one, we can divide our India in 5 zones: central zone, north zone, east zone, west zone, and we can have sub-centers in those zonal area. I invite you, sir, for central zone. My colleague Dr. Bakshi invite you for the north zone. In our central zone, in our MP, sir, I am advisor for Medical Council of Madhya Pradesh, and at present, I am advisor to develop the new medical colleges for Madhya Pradesh. There we are facing a lot of problems, and what you have opened my eye to give idea to MCI, that we can overcome the deficiency of the faculties. It is not only the treatment, but it is the education, medical education, which we can impart. So I remember my days when I have joined my MBBS, and in third MBBS, I saw the appendicectomy from that distance of 20 feet. It was not possible to see anything, but now it is a digital India, and we can see even say cardiac surgery, even neurosurgery or any complicated surgery at any medical college from this telemedicine. To develop it, sir, IMA is with you, and definitely we will make the history and we will change the future of the India. Thank you very much, sir, for calling me. Thank you. Thank you very much.
Thank you, sir. I now request ISRO to play a short documentary highlighting their role.
Even today, most of India lives in villages with large populations residing in rural areas. This has led to an urban-rural divide, especially in the fields of health and education. Most of the health facilities and specialized medical manpower in our country today is urban-centric, and the Indian healthcare system is faced with the challenge of providing quality services to the substantial rural population. ISRO recognized this problem very early, and a telemedicine pilot project was initiated in 2000. It connected Aragunda Hospital in Andhra Pradesh with Apollo Hospital in Chennai. This was India's first VSAT-enabled modern secondary care village hospital and was commissioned on 24th March 2000. Thus was born the idea of telemedicine, and its potential to benefit our people began to dawn. Based on the experience of the pilot, ISRO launched and started satellite communication-based telemedicine program in 2001. Through this initiative, several projects in various states across the country were launched. Let's go back in time to early 2000s and find out how telemedicine, even in those days, was benefiting the rural public. We go to a remote area in Leh, where a 14-year-old boy, Wangchuk, is at Sonam Norbu Memorial Hospital as he is unable to walk due to severe back pain. The doctor of this hospital knows that the case is complicated, so he consults the super specialist doctor located in Amrita Institute of Medical Sciences, Cochin, through the INSAT communication satellite, sharing his patient's medical reports through the network. The glittering eyes of Wangchuk's doctor says it all. He knows that sooner or later, Wangchuk will be able to stand on his feet once again. There have been many such experiences across India which followed when a large number of telemedicine nodes were created. Number of district hospitals across the country, also covering remote regions in J&K, northeastern states, Andaman and Nicobar, and Lakshadweep Islands, were connected to the various government and private super specialty hospitals. Over time, ISRO's telemedicine program has been enabling quality health consultations to underserviced areas of the country. The program virtually connects patients located in remote areas to super specialists located in cities through satellite communication. Through video conference, the specialist doctor sees and interacts with the patient. If required, X-ray, ECG, and other diagnostic data of the patient are also communicated to the specialist through TM software. The necessary specialist medical advice and guidance is then provided to the remotely located patient through local doctor. With advancements in communication technology and medical science, several organizations inspired by the early success of ISRO have come forward and today deliver healthcare through telemedicine and are duly validating its impact on clinical outcomes with scientific rigor. Many such initiatives are noteworthy. The ISRO network, Aravind Eye Hospital and Shankar Netralaya in Chennai have for many years provided extensive tele-ophthalmology consultations to lakhs of patients across India. They also extensively used SATCOM-enabled mobile vans for this. Sri Ramchandra Medical College, SRMC in Chennai, has provided teleconsultation service to the populations in Andaman and Nicobar Islands. It may be pertinent to note that an ISRO telemedicine patient node at Port Blair and Campbell Bay was the only means of communication during the 2004 tsunami, saving large number of lives. This facility also serves as a tool for disaster management, support and relief. For years together, SRMC mobile van, having ISRO VSAT connectivity, has provided services extensively to the doorsteps of people in various villages and remote places. SGPGI Lucknow, SCB Medical College Cuttack, PGI Mer Chandigarh, AIMS New Delhi, AIMS Bhopal, JIPMER Puducherry, Narayana Hridayalaya, AIMS Kochi, Army Hospital R&R New Delhi, and many other hospitals have provided super specialist consultations across the country, benefiting very large number of patients. Today, Apollo Telemedicine Networking Foundation, by leveraging various means of connectivity, has emerged as a large private healthcare provider in the area of telemedicine, with over 150 peripheral centers in India and 15 overseas. It is managing 164 EUPHCs and 115 teleophthalmology centers for the government of Andhra Pradesh. It has also provided nearly 10,000 consultations to a location in Lahore and Spiti at a height of 14,000 feet through SATCOM. Government of India, in close collaboration with institutions like SRMC Chennai, Apollo Hospitals, SGPGI Lucknow, PGI Merck Chandigarh and TCIL, enabled a Pan-African e-network project to establish a VSAT-based telemedicine and tele-education infrastructure where 10 super specialty hospitals in India provided telehealth services to 53 remote African hospitals via a hybrid of ground and satellite network. From SRMC alone, 540 lectures have been delivered to various member countries of Africa in the last 6 years. The value of telemedicine has now been duly appreciated in the country. The Ministry of Health and Family Welfare and ISRO have joined hands and have signed an MOU for giving impetus to this activity. Working together, ISRO telemedicine connectivity has been extended to various other remote places, some of which attract large congregation of population. Pampa Hospital at Ayyappa Pilgrimage Base Camp, Kashi Vishwanath Dham, Vindhyachal Dham, Poo in Himachal Pradesh, Dehradun, Dwarka and Jamnagar also now have telemedicine nodes that are linked to the super specialist nodes. The telemedicine mobile van of SGPGI Lucknow, augmented with VSAT system, has been providing telemedicine facilities in the field. At Kumbh Mela in Ujjain, this van benefited a large number of pilgrims. Braving extreme weather and otherwise disturbed conditions, difficult terrains and other unexpected challenges, a joint team of ISRO and J&K Health Department installed a telemedicine node at Sheshnag Base Camp, en route the holy shrine of Amarnath, at a height of approximately 13,000 feet. Recognizing the needs of defense services, who are generally located in extreme remote locations, Integrated Defense Staff Medical, ISRO and Health Ministry have ensured that there are 20 telemedicine centers at different defense locations in the country. It is worthwhile to mention that our soldiers at extreme remote and high altitude locations also now benefit from this facility. Besides teleconsultation and treatment through telemedicine networks, telemedicine program has also initiated continued medical education services, which are conducted regularly from ISRO's DECU studio located in Ahmedabad. Telemedicine is a concept shaped by technology, and ever since its inception, it has continuously evolved and matured, thus providing diverse delivery platforms to bring the patients and doctors closer. As pioneers in this field, Indian Space Research Organization and the Ministry of Health and Family Welfare have now created a platform for its more effective implementation and utilization to bridge the urban-rural divide in the country.
Thank you Team ISRO for the informative documentary. May I now request Dr. K. Sivan, Chairman ISRO, to deliver his address. It was Dr. Sivan's expertise that gave ISRO the ability to send 104 satellites in a single mission, thereby setting a world record in February 2017. Dr. K. Sivan.
Professor Dhanapati, Ms. Sangeeta Reddy, Mr. Ashok Sangal, representatives of Indian Medical Association, representatives of Telemedicine Society of India, as well as dignitaries from the different organizations assembled here, and my dear colleagues from ISRO. So good evening to all of you. Today, when I met my colleague Virender, I said telemedicine needs some medicine. Some kind of stimulants required. At present it is not, it has become slightly going the downward trend. I fully agree with Professor Ganapathy. The importance of telemedicine I can understand and I can speak a lot because I came from a village which is suffered from the health environment point of view. I can understand the importance. All of us are aware that ISRO's the vision was mainly to serve the country, mainly because of the criticalities of the critical country, our in the nation, because of its vastness and both length and breadth, and as well as the diversity of the different areas of this particular country, along with the most important, the disparities between the poor and rich, or disparities between rural and urban divide. These particular things demand actually the technology to be provide solution for all this problem. This was the first and foremost requirement for the 6 years back in front of Dr. Sarabhai. And he said that the advanced technology, the space technology, or you can even the space-based services, if you are able to serve the country, to all the people in the country, also the far-reach people, almost the 75% of the people are living in that far-reach people, the region. If the technology or effort is reaching them, that serves a real purpose and that we can build the nation. This was a purpose. And telemedicine was a concept. Actually, it is not a new thing. At 1975 itself, during Aryabhatta days, Dr. Sarabhai transmitted the EGC signals through satellite. Not now, 75 itself, through the site experiment, that is the satellite instructional television experiment that he conducted in 75. This is the starting point. Definitely, that one of the applications what he has in the mind was on the telemedicine, but that time maybe some other name he would have kept in the mind. But that had got fructified in 2000 in the advancement of some of the technology like communications, information technology, and also this that telemedicine is coming as a very innovative applications of the space system. The synergizing the many technologies, that is information technology, communication technology, along with the medical sciences and satellite technology combined together is an innovative application. It was produced or it was, I would say, that invented in 2000, and it was demonstrated. He has Virendra's video you have seen how it was used. Nearly after starting, the system got picked up very nicely. Nearly 384 hospitals were in the loop. Nearly 300 hospitals from rural areas and 60 hospitals from super specialty hospitals. With many the very important hospitals in India, they took part. In addition to about 20 the mobile vans, all together done a very wonderful job. Suppose a typical example we have seen through the video recording. You can understand that one very good thing was that is the telemedicine. Not only it will give you the product support, it instill the confidence on the patients as well as the practitioners. That was very important. And this type of thing was going on, but at the same time, suddenly it started declining. We understand that at the time of initiation of this telemedicine in 2000, we didn't have much resources. Satellite connectivity was not that good. The data rate was not very much. At the same time, with limited resources, some kind of wonders were done, and in fact that many of the foreign countries appreciated this effort, and they wanted to emulate these particular the systems in their country. But unfortunately, this system slowly got deviated. Same time, you can understand that last 2 decades, you can understand that the type of the development happened in the communication technology as well as this information technology, and it's influenced that each and every the person in the world globally. And right now we are talking about internet, e-governance, e-systems, and all e-health. Everything is not the words or buzzwords of the tech service. It is really the common people's words. That much development happened with advanced technologies and sciences. In addition to that, not only the technology, science and technology, the engineering technologies, definitely a lot of improvements happen in the medical sciences also. But combining these two things, we can do wonders. But instead of that one, the curve was negative direction. Instead of positive, this became negative. At the same time, this is not possible to make it positive. Yes, is it make it possible? Why it is failed? The not taken off the proper way. I feel, in my opinion, it is that there was no system we built. It is like a set of people responsibility. That only is not making the system. It is essential now, considering the development technologies, we have to bring in the system. Recently, it is now the present method of the strategy of any technology is don't depend on only one system. Even if we are talking about engineering system, we always look for a system engineering approach. The discipline, various disciplines will be any product if you take is not only due to one particular discipline, bring the advances in the other discipline, make the system more effective and innovative. That is the present system. That only make the system more cost effective, highest performance. This similar approach now, we have very recently we had discussion that the Indian Medical Association and a team of doctors came to ISRO headquarters, whether we can make use of the space technologies even for the normal medical services. Very interestingly, we identified nine projects. These projects, even you can include that, like we have done many image processing, and we are handling that very huge data. Whether make use of that big data analytics along with artificial intelligence. These are some of the terms we are using in our technology. Whether we can use this one in the medical sciences. Yes, we can use it. You know that doctors know very well. That is, suppose if you are taking one scan, the results of the scan or diagnosis based on the scan, it depends on individual doctor. It's more relative. The way doctor understood the results, diagnosis can be different. It may be good, one doctor may think is good, one doctor may tell bad, that is not absolutely it's not correct. Is it possible to have one system, error-free, a single result? The same scan report you give to the 10 doctors, you get 10 results, 10 analysis results. Is it possible to have a single result by having the skin? Yes, it is possible. There are technologies available in ISRO. Make use of that one. We can have the big analytic with artificial intelligence, we can bring in. But this type of system that we can do it, this is making the synergizing between the space technology and medical sciences. We can do wonders. This type of many technologies, we can always transfer the technology from ISRO to other common services to the medical service especially. At the same time, this should not be stopped with that one. How to bring the so-called telemedicine. Telemedicine, no point in just keeping as just as an advertisement. Now we have to make it as a real system. Mainly, we have to bring the people where this is many people that are unserved or underserved. The system should go to them. At the same time, not only that one, the telemedicine, the total objective, the role. Now it is right time to think. Is it the right way, whatever we considered in 2001? Because last 2 decades, the doctors then very nicely has told, last 2 decades many technologies have changed. it is the right time to revive, to revisit the objectives, how to redefine the objective, and I'm sure that we cannot leave the whole thing to one particular organization, particular group of people. We have to have a national system, and I'm sure that Ministry of Health and Family Welfare is really doing a wonderful job. And already that our Honorable Prime Minister Modi ji has taken one review on the making use of the space technology for the common man. I think that it's the right time that we have to sit together, maybe Indian Medical Association, ISRO, we can sit together and we work out a strategy and let us redefine our telemedicine strategies. And with considering the advancement of the technology as on what we got, definitely the technology what we conceived at 2001, the technology now they are different. Considering new technology, we have to revisit the total system. Let us work together and have a system, we can build a system. With that, we will make the system to grow, and the present government is really positive in this aspect, and will ensure that the real services is reaching the people, the needy people. There are ways of doing, and I am sure that we can do it, and ISRO is for you, and ISRO is for a common man. And let us work together to ensure that the real benefit of the technologies, either space technology or medical sciences, is reaching the people, needy people, the right time. Let us all of us work together. Thank you very much.
Thank you, sir. Thank you for your illuminating words. May I now request Ms. Sangeeta Reddy, Joint Managing Director, Apollo Hospital, to deliver her talk.
Honorable members of the IMA, the Telemedicine Society of India, representatives of the family, significantly representatives of the armed forces, and other senior doctors, and healthcare evangelists, people who have a passion to use technology to bring healthcare within the reach of people, members from the ministry, Mr. Bedi is here from the IT sector, everybody, I think all of us are here with a common aim, with a common goal. It's a matter of great happiness and joy for me to be here 18 years after that significant event when we connected Aragonda to Hyderabad and had Hyderabad doctor give that opinion on the young child who had a hole in the heart, and the cardiologist gave this opinion. When we first started trying to do that, Aragonda at that time did not even have a telephone board or a junction. So we first tried to put 3 phone lines together. We coupled them in to try and get adequate bandwidth to get communication. And that's when we had the idea and the hope to go to ISRO. That was in '99. And said, can you please help us with this transmission, because you are the only source of high bandwidth, reliable connectivity between point to point. And ISRO was magnanimous and said, yes, we will find a way to do it. It's for the public good. You're connecting rural India. And with that one historic moment, they say the rest became a natural sequelae of an initiative to serve public. So it kind of took a movement and a momentum of its own. And now you may ask, now why do you need a telemedicine day now, 18 years after this thing has happened and so many people are connected? Apollo itself has 60,000 connections in partnership with the Ministry of IT, the government. Why do you need this now? But I think first, as we celebrate this day, we must acknowledge the tremendous role that ISRO has played to prove a point, make that work, and then proliferate it to multiple hospitals, both government and private, and say that ultimately if you're serving the people, I don't care whether you're government or private, go out there and serve people. So I want to thank you and congratulate you and every member of the ISRO team for the leadership and the openness that you have shown to make this happen. But I think every good thing that happens puts a greater pressure on us to do more of good, because you've proven that. And I think that's really the call of today. Why telemedicine? because the power and the potential is not living up to the need of the promise that we made to people to bring healthcare within their reach. So let us find a way. Can we do e-screening? We once took a bus from Ajmer all the way to Argonda, screening diabetics, both diabetic and pre-diabetic. We screened people with, women with cervical cancer. We transmitted the pap smear into pathologists who were sitting in our super specialty hospitals. Because you know what is worse than not diagnosing a woman with cervical cancer? What is worse is if you've diagnosed but you can't go back and find her. Because in our old pathway, we used to take all the slides back to the city. And 20 days later, we'll go back and try to find Nagama, Anjama, Muniamma, and we could not find those people. Today, we use the satellite technology. By the time they watch a movie and have lunch, we got the report back and we can immediately plan who has treatment and who goes home. That is the difference that telemedicine is making. But can we say we need to screen 500 million people across, whether it's diabetic, first stage cancer, cardiac problems, children with congenital heart defects, and find a way to diagnose them and treat them? Can we use e-consultation so that nobody, not one of our 1.3 billion people is denied a doctor's second opinion, because doctors do have bandwidth that they can give. If they can sit for 1 hour at home in the evening, they will happily give that teleconsult. Traveling to the village may be difficult, but sitting at home or sitting in the city and doing teleconsult is not difficult. We can find a way to do it. Can we create clinical pathways so that the best of knowledge, which is being practiced by some, can be available at the touch of a button to a new MBBS doctor, to an ASHA healthcare worker, to somebody in any healthcare setting? Can we use e-ICU so that the critical care specialist can reach out and connect into critical care centers, whether they are public or private? Can we use e-learning so that we update the knowledge and the capability across doctors, ASHA workers, telemedicine specialists? So we're continuously in an e-learning mode. Take content that we have created in some of the medical colleges and share it across the 550 medical colleges. I think that point was mentioned as well. We can do all that and more. Last month, I was at HIMSS in the US, where we announced a partnership with Microsoft to create artificial intelligence in cardiology. So we took 54,000 patient data records, de-identified, analyzed them to see the precursor of cardiac conditions. The Framingham study studies 7 parameters for precursor of cardiac ailments. In this, we took 21 parameters of an Indian base. The propensity for accuracy is 0.3 in the Framingham study on Indians. The model which we have already done in the early stage of only 4 months of work, the accuracy is already 0.7, and the scientists are saying, the data scientists are saying, we will reach 0.95 accuracy. Can you imagine if we could find that early, so that we don't wait for a young man to have a cardiac problem and have an MI, and sometimes we lose that young man before he reaches the hospital? Or when we see cardiac patients in the hospital, we see them with 3 stents and 4 stents and 4 vessels blocked. So the cost and the amount of suffering before we can treat them is far higher than if we can have done a simple screening test. So can we use technology to turn healthcare upside down? And I think we can. Dr. Sivan spoke about AI. Sir, we already have ISRO as a company with greatest bandwidth and connectivity. Today you have shown us very clearly that you are a company with advanced science, with advanced data connectivity, but most importantly with a very vast thought process. We will share that thought process and find a way to partner with ISRO, with the tremendous force of the IMA, because every single doctor, the front line of Indian healthcare, is not happening in advanced hospitals. The front line of Indian healthcare is the small individual doctor sitting as a GP or a practitioner in a small shop, and they are the front line of Indian healthcare. Of course, our nurses, our ASHA workers are even more powerful, but we need to find ways to put all this together. So, sir, our collective vision, if we can declare this vision jointly on World Telemedicine Day, is that no Indian will be denied healthcare for want of access or connectivity. we declare that the knowledge base which resides in the most advanced doctors will be made available at the lowest level of the healthcare functionaries, so that we can enhance the ability to screen, diagnose and treat with far higher accuracy and capability than is currently being practiced using this technology. So that of our 5 lakh, you have 8 lakh doctors, sir, but we have 5.5 lakh primary healthcare centers. So if every one of our primary healthcare centers and sub-centers, every one of our general practitioners are connected into our district hospitals, our advanced tertiary care hospitals, both private and public. If the mobile vans and the tablet that the ASHA worker carry could all be interconnected in a horizontal and a vertical connectivity, going specialty wise and staging in terms of emergency, you get priority access in triaging. And then you stage once again in terms of payment methodology. So those who cannot afford to pay get covered under the NHP scheme, so that those teleconsults are either discounted or free. Then in the payment system, those with paying insurance can take a fixed time. So we cover the access problem, the skilling problem, as well as the financial problem, and put that into a new network and model which can therefore connect the country. But this vision can become a reality if we today promise that because telemedicine is connectivity, we all connect first. Whether we are public or private, whether we are government or army, whether we are ISRO or Apollo, let's all find a way to create a joint Swasth Bharat initiative where this network and this layer of working together create a new era. And finally, as the social media has swept the country and the world, let socialized telemedicine find a way to bring access to every single person. This is not just a dream. This is the announcement or the proclamation of a passion which will convert into a reality, which I hope all of you will share and echo, that together we must find a way to make this happen. This will need standards for communication, joint protocols, and a sharing and capability, a networking across, a change in legislation, a new legal framework. But most important, I think it will require what we all have, which is a passion to bring healthcare to our country. So on this very special day of World Telemedicine, of India Telemedicine or IMA Telemedicine, let us together take this promise that we will find a way to rise and to stand on the shoulders of people who have worked earlier, who have worked hard, who have worked tirelessly, stand on their shoulders so that our vantage point is higher. So whether it is Dr. Reddy, who is passionate about finding a way to reach healthcare to rural India, and many, many others who we cannot name but we know they exist. I remember Professor Kasturi Rangan, who always kindly, representing ISRO, always said, yes, let's find a way. There are many other doctors, many other people with this passion. Let's combine this passion and the will to serve and create the new era of telemedicine, the new era of artificial intelligence, which is actually not artificial. It is augmented intelligence put in the hands of doctors and nurses to enable a better healthcare for the future. It's been a tremendous day, and I hope that the memory of this day gives us the energy to reach out so that next year when we meet, we would have collectively taken a strong step towards this vision. I want to thank ISRO, thank the IMA for acknowledging this day, for being our partner, and for giving us the courage to continue to fight towards a healthy India, and that India's model can become the model for the world, as you have done with your space technology, sir. Let us also do with our health technology. Thank you all very much. Jai Hind.
Thank you, ma'am. We will now take a few minutes for the presentation of mementos, for which I invite Mrs. Sangeeta Reddy, Joint Managing Director, Apollo Hospital, to present the mementos. I request the following dignitaries to... We request Dr. B.S. Rata, past President, Telemedicine Society of India to receive the memento. Shri Rayappa, Associate Director, ISRO. Shri Virendra Kumar, Director, Development and Educational Communication Unit, DICU. Dr. K. Selva Kumar, Past President, Telemedicine Society of India. Shri Baljit Singh Bedi, Past President, Telemedicine Society of India. Shri Prabodh Saxena, Principal Secretary Health, Government of Himachal Pradesh. Lieutenant General C.S. Narayanan, VSM in Double Bar, President Honorary Surgeon. He is the Deputy Chief of Integrated Defence Staff Medical and Senior Colonel Commandant, ANC. Dinesh Nair, Medical Director of Amrita Institute of Medical Sciences and Research Center, Kochi. Shri Vimal Vaklu, former Chief Managing Director, Telecommunication Consultant India Limited and President-elect Telemedicine Society of India. Dr. P.K.S. Sarma, General Manager and Head Technical, DIRAC. Dr. Amit Kharat, Dr. Sandeep Agate, Dr. Satish Kamath, Dr. Parvesh Sheikh, we also request Mr. Vikram Thaplu to receive the memento. Mr. Vikram Thaplu, CEO, Apollo Health Services.
Last but not least, it's my privilege to personally give a memento to Colonel Dinesh Verma. He will be the happiest person that this meeting is over. For the previous 1 week, I don't think I have slept. I have been most unreasonable. And thank you, sir. You have represented the armed forces in every way. Not for a moment did you have the slightest hesitation in accepting my most unreasonable demands. A memento will not suffice, but this is the only thing I can say.
Thank you, sirs. May I now request Dr. P.S. Bakshi, Vice President, Indian Medical Association, to deliver the vote of thanks.
All the deliberations of today have to be percolated to the general public, and we need the help of the media so that they inform the public of how telemedicine alone can bridge the urban and rural health divide in India. We're grateful to the media for their presence and for their coverage of this event. ISRO, we heard the chairman, Dr. Sivan, and his thought on how we are going in the future on telemedicine. We are very grateful to you, sir, for coming here. Dr. Virendra Kumar and his team of DECU, Suvarna, Rahul Sharma, Dhruvit, team at the ISRO headquarters, Mr. Setu Raman, Rayappa, Yashoda, and of course, again Dr. Sivan. At the Indian Medical Association level, we are grateful to the President for taking this initiative. Dr. Ravi Vankredkar wanted to be here, but we have a Mahapanchayat tomorrow. He's busy there. The Government of India wanted to introduce bridge courses to get Ayurvedic doctors, giving them a 3 months course and making them MBBS doctors. The IMA is fighting against that. Here is the solution which we get today. Telemedicine is a major solution. The government says they have less rural doctors, so they will make Ayurvedic, homeopathic, yoga, give them a 3 months course and make them doctors. We are fighting tooth and nail, but this is a very good solution. Dr. Aryan is here. We are going to take this up in the Mahapanchayat tomorrow at Indira Gandhi Stadium, and we will give you inputs of 25,000 doctors who are collecting tomorrow in Delhi, that this is a very good solution that we can work on telemedicine. Another connectivity, we have 1747 branches all across the country, even at the smallest village and smallest town. We have 30,000 office bearers of IMA who are constantly in touch with the headquarters. Here is the role of IMA. This is not the old IMA, which was not functional under the leadership of Dr. Ravi Vankredkar. We are very active now. For the last 1 month, the whole IMA the slogan has been connect with the society. We are out on bicycles all across the country to have connection with the society. So IMA is going to play a major role, and I assure you on behalf of the Indian Medical Association that we will be in touch with the Telemedicine Society. We will be in touch with Apollo Telemedicine Foundation and of course with ISRO. And definitely within the next few days we will work out something so that we have a node at the Indian Medical Association headquarters on Indraprasth Marg in Delhi. Apollo Hospital, we heard the vision of Sangeeta Reddy. We are very grateful to her for her vision and passion of promoting telemedicine in the country. We are also grateful to Shravan Yadav, Raji Chandra, Shilpi, Karan Thakur, Dr. Anil Tandon, Prem Anand, Vikram Paplu, Shirja, Dr. Pallavi Singh, Lata Suresh, Zina, Lakshmi Ayappan, and many other volunteers of the Apollo Hospital Group. And of course, we are very grateful to Dr. Ganpati, whose brainchild was this to organize this telemedicine meeting at Delhi. We are grateful to Research and Referral, Army Hospital, Delhi. We are very grateful to Lieutenant General Narayanan, who initiated the Rayan with all the organizations and having this meeting organized in this RNR hospital. Very grateful to Colonel Dinesh Verma, Lieutenant Colonel Ankur Gupta, and their team, including Mr. Sanjay. Also the administrative unit, the commandant, the deputy commandant, and brigadier in charge of the admin. The Telemedicine Society of India, we are grateful to Dr. Ashok Sangal, Sri Satyamurthy, Vimal Baku, Baljit Singh Bedi, Selva Kumar, B.S. Ratta, office staff Neeraj, and the executive committee of the Telemedicine Society of India. The speakers, Soumya Swaminathan, Amit Kharat, Sandeep Agate, Satish Kamath, Parvez Sheikh, Sri Prabhuddha Saxena, PKS Sarma, and Dinesh Nair. And of course, not the least, all the delegates who have come from all over the country to attend this meeting. Thank you very much.
to the program. As the organizing chairman of this year's Telemedicine Conference, Telemedicine 2018, I request all of you to mark your calendar. November 1st, 2nd and 3rd is the conference in the Amaravati, the new capital of Andhra Pradesh. I request all of you to spread the message, bring more ideas and suggest more suggestions, give more suggestions for conducting the sessions and bringing the problems to the forefront of discussion. Thank you once again.
Thank you, sir. We shall now be playing the national anthem. May I request all of you to stand for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे